So we'll start by reading the case out. Mariah is a star Division II track and field athlete, following in her sister and mother's footsteps by attending the same school years later. Both her sister and mother competed in the same events in the same institution. Track has always been part of her family. During her junior year of training, she was particularly training hard and performing extra sprints prior to practice in an attempt to better her sprint time. Partway through the season, she started to notice pain on the anterior medial side of her right knee. She tried to sprint through practices and ignore the pain, but eventually mentioned it casually to her athletic trainer. Mariah was reluctant to give the athletic trainer full details on her knee pain because she did not want to miss an upcoming meet. The athletic trainer insisted to her concerns and assessed her knee, provided her with a treatment and rehab plan. Mariah said she would come in a foam roll stretch and heat prior to practice, but declined wanting to start up a follow-up appointment with the athletic trainer to begin a formal rehab plan since she would take away from her pre-practice sprinting.
Okay, so the first question is, from a biopsychosocial perspective, what else would be helpful for the athletic trainer to know about Mariah to help identify possible barriers to rehab? So some that we could do off the bat is just like some biological factors, so knowing like what her nutrition and sleep patterns are, just to be able to know if like she's getting the good sleep, since she is doing the extra sprints at practice, and then also knowing like what her nutrition is to see if she's keeping up with that and having enough energy to be able to do all the extra stuff during practice.
Yeah, and I think that there could be some psychological factors that we could try to figure out as well, like what is her personality like in general, what's her emotional response to difficult times such as stressors and other things that may be coming up in her life, and how she deals and copes with that. It's tough to sit down and actually ask the person that, but maybe ask them a few simple questions as like, what's a good way for you to relax or deal with stress when it's a stressful time? Another thing too is maybe looking at her family situation. I know it noted that her mom and sister were big track athletes as well at the same school, and that expectation that they have probably for her that they don't really mean to have, but she has created for herself, is probably a big stressor in her life. So looking at her social support that she has from her family and the situation she's putting herself into with the expectation she has for herself in her performance as a track star.
Personally, I think a longer talk with this athlete and getting to know them would go a long way in this situation, because I mean, it's not necessarily normal that an athlete would want to experience pain and would not want a pain to go away in this situation. I mean, most athletes do have a high want to compete and everything, but it's still not normal for them to want to go through this pain. So figuring out and developing rapport with this athlete and getting to know them could go a long way in figuring out what the source of this non-adherence to the want for treatment is.
Yeah, I agree. I think going back to like future or previous chapters and talking about forming those relationships with the athletes is very important, because like she's a junior, so she's been there for a few years, so you probably have had interactions with her, so knowing how like what her personality is like Josh said, and then how she usually responds to injuries if she's had ones before, and just figuring out what her cognitive appraisal of this injury is so that she can be the most successful in her rehab if she does choose to do that.
And like Kelsey said in previous chapters too, is we've also learned that when there is a stressor or some sort of thing that takes your mind off of your performance, it does increase your risk of injury. So maybe even letting her know that too, like, hey, if we deal with the situation now, you won't be bugged by it or annoyed by it anymore, and it'll decrease your risk in making it a serious or more serious injury. So,
and going over what I said previously, and like Josh was saying, having that discussion with the athlete about the possible risks of doing this versus doing that can then maybe help them adhere more to the rehab program. So then they'll know that them not doing this rehab now could potentially have them miss the entire season, and I guarantee that's not on their priority list. So rationalizing with them that this short-term rehab could potentially prevent a bunch of long-term misses in competition that are easily prevented by this short rehab.
And so just bringing in the patient education piece and making sure they're fully aware of the risks and all the things that could happen based on what they choose to do.
I also think it's a tough kind of place right here to decide if, I feel like her personality-wise, she wants to do everything she possibly can to perform at her peak level. and to try to twist that and spin it so that she feels like she's able to do that in the athletic training room would be very beneficial. From the case that we heard, I don't feel like she's one to take shortcuts on anything. So trying to use that to our advantage with her personality trait and seeing if we can incorporate her personality and wanting to do the best and doing everything extra and spinning that into maybe their athletic training or rehab process to help her out in the future.
Anything else?
Not.
Okay. So number 2, what possible strategies could be used to avoid potential barriers to rehab and return to play for Mariah? So I think a lot of the things that we've talked about previously you can use. So like a major one is goal setting. So I know she wants to be able to run in the meet this week or the next meet, but just sitting her down and letting her know like what the consequences of her running in that meet would be, and then that would be setting her back. So just setting a goal, like a realistic goal with her, to just keep in mind that she might not be able to run in this meet, but the next one's coming up and she wants to be 100% for that one.
I think something that goes along with goal setting too is justifying and convincing the athlete on the importance of each meet. So say you're missing this meet, you have to kind of be a sales pitch to them and say like, hey, you're missing this meet, but if we're able to work and take this meet off and work and try to figure out this problem now, you could be sprinting or running and competing in the more serious meets at the end of the season, like conference or regionals or nationals. So letting them make the decision on which meets are more important right now could help her with goal setting, like Kelsey was mentioning.
I believe that goal setting is actually one of the best forms of strategies you can implement with this athlete, just simply because of how driven she is. So setting these milestones for her can give her like something to achieve for along the way, even in her rehab. Because I mean, obviously the end goal is to get back to competition, but setting these short-term goals can give her just milestones that she could see to and be really points of interest that she wants to get to in her rehab, and as she progresses through this injury from early stages to end stages, hopefully.
Yeah. Another one we could do is like going into her relaxation and stress management. So if you do find out that one of her biopsychosocial factors is like the life stresses and the outside stresses, besides like school or track, you could take her through some somatic relaxation techniques and just making sure that her anxiety levels are low and just reducing her stress the best that you can. And that will hopefully help her heal overall.
Yeah, and you're building her mental game as well by giving her these techniques to use when she is in a stressful situation. So letting her know that too, that you don't have to justify. You can justify and say, hey, we may not be training the physical right now, but right now we could be training the mental, and this could help you in the long run as well as performing at your peak level. And also letting her know that this is your junior season. You do potentially have another year of running, and we want you to be able to perform and leave this place proud of what you've accomplished here. So kind of, like I said before, giving her that sales pitch to give her a better perspective on how she could be performing later down the road.
Yeah, the early identifiers of that her mom and sister both were track runners or at the school kind of lead me to believe that those are probably the lead drivers to her wanting to be successful like the rest of her family was. Given that is a thing, so on.
I don't know where you're going with that one.
We can talk about athletic identity. I think that's what you're trying to go towards.
Yeah. So that would kind of develop her athletic identity to be that. And I really lost my train of thought on that one. I will be back with this.
She probably identifies herself as an athlete, and there's probably a lot of factors that her family has given her to identify herself as that. So taking that sport away from her in this rehab is probably a big stressor in her life, because that's what she identifies herself as, is a track runner, and that she's part of this prestigious family who's been successful at track. So like Aubrey was saying, going into those factors and helping her talk through that, giving her other strategies like self-positive talk, and making sure she realizes too that she's more than just an athlete. She's a great person as well, hopefully, and building up that confidence as well with self-talk and other things.
Yeah, and also going off the athletic identity, self-imagery might be important for her, because if she isn't able to run for a week or so, just having her keep those thoughts in her head and think about the positive times that she was successful running will be helpful in keeping that athletic identity with her while she's not able to run.
Getting back on track to where I fell off at, developing her self-injury is definitely important in the situation, because it seems like more so she's trying to build herself around what her previous family members were, instead of developing into who she could be or potentially be in this situation right now, developing her own athletic identity, or her own image in this situation, kind of too much following in others' footsteps, and that could be a heavy load on her psychologically. So talking about that with her could definitely have some, either if not positive results, of identifying what is driving her to want to go this route versus the more reasonable route of rehab and reducing her injury potential.
Like Aubrey said, laying that out for her to see it in a different perspective is important as well. She'll probably think like, yeah, no, I'm my own individual person, but if you give her the time to talk it out and lay it out on the table and have her realize from a different perspective on what her goals are, why she's performing and why she wants to be a track athlete, and her future goals after, college or being an athlete, having those all laid out for her to actually see in a different perspective would be important as well, because that'll create a stronger identity of herself as a person and as an athlete. So.
Another factor that we could bring in is just keeping her engaged with the team. Like if she's not able to be out at practice actually running, talking with her coaches and teammates and just figuring out a way that she can still be involved, so she doesn't feel like she's just like out of the loop and not a part of the team anymore while she's not able to run. So just keeping that in mind too.
And with the team aspect as well, getting the coaches on board of being supportive, with her being working hard to get over this injury that it has occurred, and having them understand too and preach to her that if you miss this one week, that's better than you missing these more important ones down the road or missing your whole entire senior year. So having that communication with your coaches is also important, like we always discuss.
Another way you could have her maybe adhere to the rehab program more is instead of make it somewhat based on her sport. So instead of pulling her from track, integrate the rehab so that way it works mainly more on technique, so it's not as stressful on her knee, but she still is getting a benefit from the rehab, progressing her towards her end goal right now.
Mm-hmm.
You guys good with that one?
Yeah.
Next question.
Okay, number 3. Based on this case study, discuss how Mariah's response would be based on the following frameworks and why. So the first one is the personal investment theory. So we kind of wrote down what that actually was. They have beliefs of personal self to adhere, so how they would actually be adhering to the rehab. It has a lot to do with confidence and motivation in themselves. And then it also deals with their future sport plans and their rehab treatments that they would be doing at that time. So I think it was how Mariah would respond based on that information.
And like we talked about before, our strategies with dealing with the stressor would tie in very well with that first theory, with positive self-talk and understanding your athletic identity, building confidence and motivation in yourself to adhere. That would come along with building confidence in yourself in general. And then future sports plans and treatment. So like if she does, like we said before, with her self-identity, understanding what she wants to do after she's done being an athlete, her junior and senior year, and being able to look back and reflect on what she wants to do in her future. So I think those tie in pretty well with that.
And also the positive self-talk for the first point of beliefs of personal self to adhere. If she's constantly having those positive self-talks and believing in herself and setting those goals, I feel like she'll be more successful to adhere to the rehab and to herself.
I believe, again, that talking to this athlete would be the best thing. So understanding where her mental is, and developing that rapport, so you would know whether she is does have these perceived self-thoughts on herself that could possibly negatively impact her rehab.
Mm-hmm.
I believe too, with her support system, I think it'd be important to have a discussion with her on that and see what motivates her. Is there does she have any support from her family or friends, and being able to help her realize like they're there and they care for you, and they don't really care if how you do. They just want you to be happy and be able to be proud of what you're doing. So building that would also build her personal investment into herself.
Mm-hmm. So. And just reminding her of her future sport plans. Like if she's planning on running for one more year, just letting her know that if she were to keep running, that this might set those plans back. So just taking the proper treatment now would be more beneficial than being set back and not being able to run like in her senior year.
And then once his injury is resolved, then possibly working with her to find if there's a source of her injury. So looking at her running gait to make sure that there was no chronic onset of it. Looking at her shoes, what shoes she's wearing constantly, seeing if that has an issue with changing the way her ankle angle and knee angle is while she's running. So there could be a multitude of predisposing factors. Helping her identify those could possibly prevent this injury from reoccurring.
Mm-hmm. I think that's good. Do you want to read the next theory?
Yeah, the second theory was the protection motivation theory. And some key points we got from that one was that athletes are most likely to adhere when they perceive their injury as severe, which is kind of a cool rhyme, and they view themselves as vulnerable to future damage if they do not complete the rehab. Another thing is that they believe rehab is effective in treating their injury, that they believe they are capable at completing the rehab. So we talked about this one, and we thought that this one really corresponds with patient education and allowing them to understand the severities and risks of the injury and what it can have on implications further down the road. So.
Yeah. So if we, as the athletic trainer, sat down with Mariah and told her what her actual injury was, like in describing it in ways that she would understand, and just letting her know the severity of it and how it could affect her future running, I feel like she'd be more likely to adhere to the rehab now, and then instead of waiting till it's too late.
Because at face value of this case right here, it seems like either A, she doesn't really care too much about her injury, and she's unhealthily motivated to run in the sport when she's not fully 100%, or B, she is uneducated on the situation of her injury. So explaining both of those out to her could definitely put her in this situation where it would help her in the long run.
Like Aubrey said, sometimes you need to take a look at if the athlete is trying to portray themselves as tough and they're trying to fight through pain. It's very common and it's very easy for an athlete to want to fight through pain to be known as they're very determined, they're tough, that kind of stereotype. But in the long run, they need to sit down and realize the implications that working through an injury like this can have when we're catching it as early as we can, and then trying to work through it. You'll have better results in your performance later down the road. Another thing that we were talking about before is believing that the rehab is effective. So, like Kelsey was saying, being able to break down the terminology and make it so that it's easy for the athlete to understand why the rehab is important for treating their injury and how it can improve their training and their performance later down the road as well.
Mm-hmm. And tying in those goals with that aspect as well, and just giving her like a timeline to work towards. I know that not every rehab is going to be a certain timeline, but just having those goals in mind so she has something to work towards, I feel like the rehab would be more effective because of that.
And then believing they're capable of completing the rehab, so making sure the progression is not too difficult so that their adherence is a little better. Just like in any training program, you don't want to be starting off with the super difficult stuff. You want to be able to let them feel like, hey, I can do this, and then once they're able to complete that task at mastery, they can up the difficulty of it and the intensities to help them become stronger.
Yep, and having that positive self-talk aspect within that component of it would be beneficial because believing that they're capable of completing the rehab and having that positive self-talk, they'll be more likely to adhere to the rehab and more likely to have a positive outcome with that rehab.
Mm-hmm. So I think both of these theories would be definitely beneficial within Mariah's case that we're talking, just because of, like we said before, having her understand the severity of the injury and being able to understand her investment as a person, so her personal investment in buying into the rehab is very important within this case.
Like I was saying, given at face value, I personally believe that the personal investment theory would be the one she would more adhere to, just like given the way she has reacted so far to the idea of rehab. So getting her invested in the rehab and getting her motivated so that way she understands fully of what the ramifications of her not adhering to the rehab could be.
Mm-hmm.
Is there anything else in this case?
Yep.
All right.